brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. And welcome to a new episode of Health from Huda TV. I would like to welcome you to this episode and thank you for calling us, and would like to welcome you watching our... Actually, I've been saying welcoming you for many times. Yes, this is not a blooper. This is what happens, and this is our topic today. Our episode is about a problem that somebody would keep on repeating something permanently and persistently for more than one time, and even though he's aware or she's aware of this problem, they just keep on doing this. So this, what we've been talking about today, about what we call obsessive compulsive neurosis, and today with us is Professor Dr. Hashim Lahari, Professor of Psychiatry and head of the department in the Azhar University, Cairo, Egypt, to tell us about this problem that many of us, unfortunately, have with different degrees and variable degrees, and will be telling us how to manage this problem. Thank you, sir, for being with us today.
More than welcome.
This problem, many of us have. Some when they go to pray, make ablution before they wash before they pray, they wash their hand maybe 10 times or 15 times, and they come out from the bathroom and just return back because they think they forgot to do it. Or even doing prayer during the salah, maybe they would do the ruku' maybe several times, or their sujood several times, thinking that they have not done it. And of course, you know more than me that the problem is even worse for some. So please tell us what's this problem and what are the variables of these problems?
I would like to say that the introductions you did already at the beginning of this show was really very intelligent. And this is what we are going to do in our workshops. Give an example, then start to give the scientific basis after that. And this repetition you did already is giving us idea about the repetition all the time in the mind or in the act. And this is the obsessive compulsive disorder, which the patient is still keeping doing, or thinking all the time about some topic or doing some act.
Yeah.
And it costs him a lot of time and a lot of effort and a lot of guilt at the same time. So this is the obsession as a definition, which is a repetition of act or thinking. And it affects mainly boys and girls. There is no sexual differences. And start to watch it and observe it at the age of 5 and 6 years old.
That early?
Yes, that early. It starts in a very minimal way, but every time it starts to appear more, complaining more, and the complaints start from the family, not from the boy or the girl.
Yes.
But all the surroundings start to say, oh, what are you doing? You are going to keep us intense because you are doing such act or thinking like that.
Yes. Would you kind of give us examples? How would the parents, if the problem is in the early stage or early age, or the person himself would discover that he or she has this problem, what would they do?
You see, Dr. Ahmed, I have many complaints from the families that my little boy don't permit any of his brother to touch his bed.
Yes.
If anyone touch his bed, he will want to change the sheet and start to wash everything in his bed, even coming with the water and soap to clean the bed itself. It start to wash the wood.
Yes, very annoying.
Yes, it is. And if someone touch his clothes in the cabinet, he start to put all his clothes in the washing machine to be sure that it is clean. And start from the age of 6 or 7. And we noted that the father and or the mother have the same picture. They are a very tough person, not flexible anymore. They give orders to their kids all the time. No one can escape from the order, and they have to follow father and mother. So they start this way from the early life. And they are dealing with kids as soldiers. No one can say no. You have to obey. You have to do what we are ordering you. So the kid himself start to watch himself. Am I doing good? Is it good really? So I have to repeat it because my father or mother gonna say something about me. They're gonna punish me because I did something wrong.
Yes.
So this keep doing and keep doing like that.
So the person is aware that he has a problem?
Yeah, sure, because he is losing a lot of time in the bathroom or thinking, and others are doing a lot of things in their life normally. But he is in the bathroom for more than 2 hours to start and finish his wudu. And maybe, as you mentioned before, after going out of the bathroom, he start to go back to the bathroom and go for wudu again. So he noted that he is not normal like others because he is spending more than 1 or 2 hours in doing any act,
Yes.
and it cost him a lot in his life.
Yes.
He has no pleasure. He is not smiling anymore. He's thinking all the time that he is doing something wrong, and what he did is not normal, and he is guilty because maybe he did it not in 100% correct. So he's gonna start to do it and repeat again and again. So it is all the time thinking, doing, noticing, and observing himself,
Yes.
and at the end, he is guilty.
Yes, what's amazing is that the person knows that he's doing something which is not supposed to do, yet he still is compelled to do it.
Yes,
That's the compulsion about the
yes.
disease.
Let me tell you, Dr. Ahmed, about the psychopathology or why
Yes, please.
it happens.
Because somebody would tell you, why me? Why
Yes,
would I have it?
this is the question.
Yes.
There is a type of personality which we come to him later. This person has a lot of stressors in his life. Maybe it is the tsunami pressure
Yes.
coming in a huge way in a very short time, or it is kindling drop after drop after drop.
Yeah.
And at the end, his life became filled with a lot of stressors. These stressors give him a picture of an anxiety. He has some fears of unknown reason.
Yes.
And this
Always
fear,
anxious.
yes, he's expecting something bad. All the time he is unsafe, has no self-confidence. This anxiety give him terrible life. But the brain cells can't resist this anxiety. The anxiety start to harm the brain cells. To overcome this, the brain himself, it changed this anxiety to obsession, to protect the cell. The obsession is a very weird idea, and the patient himself start to resist, but he can't. He all the time suffering, and the resistance give him no results. At the end point, he start to wash his hands or start to repeat the ideas, and he failed to face it. This gives him an impression that he is a loser, he is a failure, he has something abnormal, he is below the norm level.
Yes.
So start to be depressed. After depression, his immunity to stressors surrounding him is less. So he is vulnerable to more obsessions and anxiety. The question you mentioned, why I'm
me?
facing this obsession.
Yes. Exactly.
We discovered that the obsessive person has a specialized personality, which is a very sensitive person. From inside, he doesn't like to do anything wrong, or he doesn't like any criticism.
Yes.
He is walking on the straight lane, can't go outside it. He's not flexible anymore. He's a very sharp person.
Yes.
So all the time he is a very tough one, number one against himself, then against others.
Yes. So, how would somebody suspect that he or she do have this problem? How would I know?
He's spending more than hours and hours in the same idea or same act, and he's missing his life, his pleasure, his nice time with others. He's isolated, and all the time thinking about these ideas or doing this act. So he's not normal. And his family start to see that, what are you doing? why you are keeping yourself isolated? You have to come with us, and there is no way to give him an idea about the pleasure he is missing and to take him from his room to outside. All the time he's keeping himself isolated.
Does that mean that all the people who would have this problem would just lock themselves up, or they still can go to work and do the jobs like they have to do,
Uh-huh.
and then they come back or at a certain time of the day or their lives just perform the act of being obsessed?
It's a very good question.
Yes.
We know that it depends on the obsessive disorder type,
Yes.
which I mean that someone has a mild, moderate, or severe case.
Mhm.
In a mild and moderate, he can go outside working, and it comes in waves, Dr. Ahmed.
Yes.
Sometimes he is completely normal.
Normal.
Sometimes he is suffering a lot.
Oh.
And sometimes it is related to a place itself. You find that he is looking for the cleaning hands and wudu many times in his home only. But when he is going to a hotel or away, a place away from his home, he's quite normal.
Yes, that's very interesting.
Yes, it
Very
is. It is related to the mother-father way of education and observation. So this place, these walls surrounding him, reminding him all the time that mommy and papi are following me. So I am obsessed. But when he's going outside, no one following him. It's quite normal.
Yes.
This is why the obsession started at the early life, because the focus started to mother and father put him under focus from the early years of life.
Okay. We have a short break and we'll be coming back to talk more about obsessive compulsive disorder. Brothers and sisters, we'll be going a little bit, in a minute we'll be back, so please don't go away until then. Assalamu alaikum wa rahmatullah. Brothers and sisters, assalamu alaikum, and we're back and we're still talking about obsessive compulsive disorder with Professor Hashim Bahri, head of the department and professor of psychiatry, Azhar University in Cairo, Egypt. Sir, we've been talking about the problem and how would somebody know or suspect that he or she has the problem. But when they do that, probably a little bit of them would come to you or to the psychiatrist, and I believe, to my imagination, that most of them would first try to treat this problem or just to live with it,
Yeah.
possibly until it grows up with them and reach to the level that really it's putting them in a bad situation in their life. So, if the person, let's talk about the person who would come to your clinic knowing that they have the problem, and the others who don't go to the doctor. First, the ones who would come to you.
Let's start from the beginning.
Yes.
Like any disorder or disease in the whole world, if I have some abdominal colic, I have an idea that I can treat myself easily by taking some drink like that.
Yes, exactly.
But if it failed, I'm going to ask Dr. Ahmed, do you have an advice to let me go through it? Because you are my dear friend. Then, if it failed, I have to go to a consultant to give me the real advice or the professional advice.
Definitely.
This is what we are going to do in the obsession. If a patient has some symptomatology, these symptoms are bothering him in his life, he starts to do something, maybe asking if it's related to wudu, he's going to ask the sheikh in our mosque or any area. And if failed, maybe asking his brother or uncles or like that. Then if it failed, go to the doctors and psychiatrist. So it depends at the education, level of suffering, and what he did to prevent or to treat or to manage his case. Then if all these failed, he's going to come to the psychiatrist. And at the early beginning, I know that he's coming to me because he is really suffering and he can't do anything more.
Reach a breaking point.
Yes, it is. And he and his family are coming to my clinic asking for real help, that he are missing his life. So we start to do something very early and at the same time very helpful, which is medication.
Medication.
Yeah, because we know in the medicine that in the psychopharmacology that these obsessive persons has minimal level of serotonin. So we give him a drug which is called SSRI, selective serotonin reuptake inhibitor, to elevate the serotonin level in his brain.
Yes.
So it minimizes this obsession and anxiety.
Very good.
But as we know, it comes in waves. So the patients start to have this SSRI group or medicine, and his symptoms improved. And he's saying that I'm okay.
Satisfied.
Yes, and no more medication, no more treatment. And he goes in the life, and after a couple of months, 3, 4 months, it starts to come again that I was okay, and the manifestations of obsession come back.
So that's a new wave of the disease.
Yes, so we have to give him the SSRI and advise him. And I'm telling him that because we know the psychopathology, and I start to explain everything to him, that this is personality and this is your sensitivity, which the obsession come to stick with your personality. So we have to modify your personality to move from this tough person, sharp person, to a flexible person. And I give him a very easy and a simple example that if we have a very big tree and it is very strong, as you are doing in yourself, I am sharp, I'm strong, and we start to see the wind. What is the wind going to do in this tough and strong tree? It's going to break it.
Yes.
But the wind can do nothing with the grass because it is very flexible. So we have to move from this tree, which is vulnerable to be broken, to the grass and be flexible. If we're going to change your personality, because you need to do that in a psychotherapy, which we call it cognitive behavioral therapy. This type of therapy going to help him to move from this personality to another personality. And it will help a lot. That when he is going to face any stressors, he will understand it and do what is going to this stressor do in his life. And is it possible to do something to the stressor? Can I overcome it? Can I be more flexible in to face this stressor? And after this training, in a 8 to 12 step, we start to find a real flexible person and can face this obsession.
So does that mean that the person would be able to stop, first of all, the medication at a certain time?
Sure, sure. And this is very, very helpful. The medicine is very helpful, but for a very short time.
Yes.
And when the patient start to know that about the obsession, which he was suffering a lot and many years before, he start to find the hope. Is it really that no obsessions anymore in my life? I can handle it, I can overcome it. And I'm telling him yes, but we have to find your flexible personality, flexible way of life. You can do it, and you can overcome the obsession by this new personality.
All right. So, as you mentioned before, being in a certain place at a certain time might trigger the wave of personality change or the obsessive compulsive problem. So, would you advise somebody to change the place they live in or they work in if the problem comes from work, or wouldn't that be so much beneficial?
Yeah, it is very helpful,
Yes.
but for a very short time as a start. And we can give him an advice if you are facing a lot of problems in this street, in this home, in this house with your parents or your mother. Okay, you can move to another place for a while, maybe for 1 month, 2 months, like that. And at the beginning, you can help yourself, but by push yourself outside the stressor. So you can have an idea and have time to modify yourself. Because if we are going to start our cognitive behavioral therapy under severe pressure, we'll find a lot of resistance from the back mind of the patient and the resistance coming from the subconscious. So we are going to face two problems, his personality and his subconscious. So we have to face one of it. So we give him an advice to move outside this home or outside this place, which reminds him all the time by the obsessive ideas or acts. And this will give him a lot of support that he can face it.
Help him loosen up a little bit
Sure.
before going into psychological treatment.
Yes, yes.
So if we give an advice to especially parents, since this problem probably starts from the early childhood by the influence of the parents on the child, what advice do you give to the parents to avoid raising up a child with this problem?
This is a good one. If we were gonna see the parents' effect on their kids, it's huge and very effective. And I'm telling parents, if you're gonna have a child, you have to read something about your kids and how to raise them. It is illogic that when we're gonna buy a mobile, we're gonna go read the papers about it, and we have to take care of any button. We're gonna hit it, and maybe it's gonna disturb our mobile. But when I raise the child, we don't care, and we start to hit him without reading, and it affects his life for many, many years. So we have to ask parents to read and to be flexible with their kids. And where I'm facing a kid with obsessive, I'm starting to start family therapy.
The whole family has
Yes,
to be treated.
yes,
Possibly they do have it as well.
yes, it's a must. Because if I'm gonna treat the kid to let him be flexible, and his parents are very tough as usual, there is no benefit of my treatment.
Definitely. Professor Hashim Bahani, head of the department and professor of psychology, Azhar University, Cairo. Thank you very much.
You're welcome.
I'm sure our viewers, and especially those who would have this problem at the early stages, would know that they have it, and would know that the possibility of the treatment is there. So they should go straight ahead and seek good medical advice from a psychiatrist. Dear brothers and sisters, I hope that you would have benefit from this episode. Until next time, inshallah, I hope that you keep writing to us. Our email is health@huda.tv, and our Facebook is facebook.com/health.huda.tv, and of course our website is huda.tv. Until next time, I wish you all a happy and a healthy life. Until then, Assalamu alaikum wa rahmatullahi wa barakatuh.